Welcome to the Module 11 Synopsis on Substance Abuse Disorders. Go ahead and take a look at the Module 11 objectives. Make sure you feel like you've met them all as they relate to substance abuse disorders. And if you haven't, go back through the material in the lessons and in ATI. See if you can find some things that help you make those connections. A substance is defined as a psychoactive compound with the potential to cause health and social problems, including substance use disorder. Substances can be divided into four major categories: alcohol, illicit drugs, including the use of prescription drugs for non-medical purposes, over-the-counter drugs used for non-medical purposes, and other substances. If you take a look at Table 14.2 in your text, it goes over that. So millions of Americans misuse substances. If you look at figure 14.1 in your text, it gives you a little bit better of a breakdown of the number of people age 12 and older who reported using substances. So let's start with controlled substances. The Controlled Substances Act is a federal law that places all controlled substances, which are substances regulated by the U.S. Drug Enforcement Agency, into one of 5 categories called schedules. The placement is based on the substance's medical use, its potential for abuse or dependency, and related safety issues. Dependence means when a person suddenly stops using a drug, their body goes through withdrawal, a group of physical and mental symptoms that can range from mild to life-threatening. You can see some examples of controlled substances categorized by schedule in Table 14.2. Substance misuse is defined as the use of alcohol or drugs in a manner, situation, amount, or frequency that could harm the user or those around them. Misuse can be low in severity and temporary, or it can be risk for serious and costly consequences such as motor vehicle crashes, overdose, death, suicide, various types of cancer, heart, liver, and pancreatic diseases, HIV and AIDS, and unintended pregnancies. Intoxication and overdose. So when we're talking about intoxication, we're referring to a disturbance in behavior or mental function during or after the consumption of the substance. An overdose is the biological response of the human body when too much of a substance is ingested. Dietary guidelines in recent years define a standard drink as 14 grams or 0.6 ounces of pure alcohol. Examples are 12-ounce beer, 8 to 9 ounces of malt liquor, 5 ounces of wine, or 1.5 ounces of distilled spirits. The 2020 National Survey on Drug Use and Health reports that 50% of Americans aged 12 and older use alcohol, 22.2% are binge drinkers, and 6.4% are heavy users. Heavy drinking is defined as a female consuming 8 or more drinks per week or a male consuming 15 or more standard drinks a week. Binge drinking is defined as consuming several standard drinks in one occasion in the past 30 days. For men, this is 5 or more drinks on one occasion, and for women, it's 4 or more drinks on one occasion. Some signs and symptoms of alcohol intoxication are slurred speech, incoordination, unsteady gait, and impairment in attention or memory. An alcohol overdose occurs when there's so much alcohol in the bloodstream that the body begins to shut down. People can have mental confusion, difficulty remaining conscious, they can vomit, have seizures, trouble breathing, their heart rate can slow down, skin gets clammy, they don't have a gag reflex that can protect their airway, and they have an extremely low body temperature. Alcohol intoxication while taking opioids or sedative hypnotics like benzodiazepines can increase the risk of an overdose. An overdose can cause permanent brain damage or death. It's important to note that it's incredibly dangerous to leave somebody alone to sleep it off who has had an excessive amount to drink. There are many ways, from a physiological standpoint, that being acutely intoxicated by alcohol can be fatal. Medical treatment of acute alcohol intoxication varies from the treatment for a chronic alcohol use. It can cause hypotension and tachycardia. It's important to know if there's other drugs like opioids, benzos, or street drugs because this increases the risk of overdose, and it impacts other treatments. So, for example, if there's a concurrent opioid overdose, then naloxone would be appropriate in that case. So, there are sets of labs that should be drawn that assess for hypoglycemia and check electrolytes. Hypoglycemia means intravenous dextrose. Severely intoxicated clients can receive IV thiamine and dextrose to prevent Wernicke's encephalopathy, and they can also be repleted with the electrolytes that they are lacking. So you're going to have different issues when you're dealing with a chronic alcohol user. So this is where we'll talk about withdrawal management or detoxification. For alcohol specifically, there's symptoms of mild alcohol withdrawal like anxiety, minor agitation, restlessness, insomnia, tremor, diaphoresis, and palpitations. Headache and alcohol cravings are also common. They'll experience a loss of appetite, nausea, and vomiting. So people can develop moderate to severe withdrawal symptoms that can last up to 6 days, such as hallucinations, seizures, and delirium tremens. Hallucinations typically occur within 12 to 48 hours, and they're usually visual. Delirium tremens is a rapid onset fluctuation of disturbance of attention and cognition that is sometimes associated with hallucinations. In its most severe manifestation, the DTs are accompanied by agitation and signs of extreme autonomic hyperactivity, including fever, severe tachycardia, hypertension, and drenching sweats. DTs typically begin between 48 to 96 hours after the client's last drink. Mortality rates for withdrawal from delirium tremens have been historically as high as 20%, but with appropriate medical management, the mortality rate can come down. So here's where we get into the use of the Clinical Institute Withdrawal Assessment for Alcohol Scale, or the CIWA. You probably heard about this in the clinical area. It's a widely used scale to determine the need for medically supervised withdrawal management. It's typically utilized in association with a protocol containing medications to guide symptom treatment. A lot of times Ativan is used along with Valium in these cases. There are 10 questions to the CIWA, and they're related to physical manifestations of the potential withdrawal symptoms. So treatment for this alcohol withdrawal is benzodiazepines for psychomotor agitation that most patients experience, and these include, as I said, Valium and Ativan. Librium can also be used in this protocol for detoxification of acute alcohol use. In 2020, about 3.4% of Americans aged 12 and older have reported using opioids in the last year. There are some signs and symptoms of opioid intoxication to be aware of: pupillary constriction or dilation from a severe overdose, drowsiness or coma, slurred speech, and impairment in attention or memory. The typical signs of opioid overdose are referred to as the opioid overdose triad and include pinpoint pupils, respiratory depression, and decreased level of consciousness. The increasing rates of opioid overdose deaths can be attributed to a couple of different things. There's an increase in prescription rate in the 1990s, with another wave in 2010. And around 2013, there's an increase in overdose deaths involving synthetic opioids, particularly illicitly manufactured fentanyl. Treating an opioid overdose involves the use of naloxone. It comes in nasal spray or can be given intramuscularly. There's also drips that can be administered in an inpatient setting. There are a number of circumstances that represent potential touch points for linkage to care and life-saving services to prevent overdose deaths found in subchapter 14.2 of your textbook. The Clinical Opioid Withdrawal Scale, or the COWS, is the opioid version of an assessment scale. It's used in both inpatient and outpatient settings for the monitoring of withdrawal symptoms during opioid detoxification. It can be serially administered to track changes in the severity of withdrawal symptoms over time or in response to treatment. Symptoms of opioid withdrawal include drug craving, anxiety, restlessness, GI distress, diaphoresis, and tachycardia. Treatment for opioid withdrawal requires a calm and quiet environment with supportive and reassuring staff. This can decrease the need for pharmacologic interventions. Clients who have associated diarrhea, vomiting, or sweats should be monitored for dehydration and have fluid levels maintained with oral or IV fluids. Some medications used to treat withdrawal symptoms include opioid agonists like buprenorphine, methadone, as well as alpha-2 adrenergic agonists like clonidine and lofexidine. What is one similarity you noted between symptoms of alcohol and opioid use? Approximately 17.5% of Americans aged 12 and older have used cannabis in the past year. Although many states now permit dispensing marijuana for medicinal and recreational purposes, there's still a need for nurses to educate people about the adverse health effects and potential therapeutic benefits linked to marijuana. The main psychoactive chemical in marijuana is delta 9 tetrahydrocannabinol, or THC. Alters the function of the hippocampus and other areas of the brain that enables the person to form new memories and shift their attentional focus. As a result, marijuana causes impaired thinking and it interferes with a person's ability to learn and perform complicated tasks. It also disrupts functioning of the cerebellum and the basal ganglia that regulate balance, posture, coordination, and reaction time. For this reason, people who use marijuana may not drive safely and they may have problems playing sports or engaging in other physical activities. If marijuana is consumed in foods or beverages, the effects are delayed for about 30 minutes to an hour because the drug must first pass through the digestive system. Eating and drinking marijuana delivers significantly less THC through the bloodstream, but because of the delayed effects, people may inadvertently consume more THC than they intended. The THC affects the brain systems that are still maturing through young adulthood, so regular use by teens may have a negative and long-lasting effect on their cognitive development. The potential medicinal properties of marijuana and THC have been the subject of research and heated debate for decades. THC itself has proven medical benefits in its particular formulations. For example, the FDA has approved the use of THC-based oral medications, Marinol and Nabilone or Sesamet, for the treatment of nausea in clients undergoing cancer chemotherapy. Cannabis intoxication, however, is defined as problematic behavior or psychological changes that develop during or shortly after cannabis use. Signs and symptoms of cannabis intoxication are enlarged conjunctival vessels or very red eyes, increased appetite, dry mouth, and tachycardia. According to the CDC, a fatal overdose caused solely by marijuana is unlikely. However, effects from marijuana can lead to unintentional injuries such as motor vehicle crashes, falls, or poisoning. Overconsumption can occur when using marijuana-infused products like edibles and beverages because it can take up to 2 hours to feel the effects from the drug. Sedative, hypnotic, and anxiolytic use in intoxication can happen. And examples of medication in the sedative, hypnotic, or anxiolytic class include benzodiazepines, such as alprazolam or Xanax, and diazepam or Valium, and lorazepam, such as Ativan. It also includes chlordiazepoxide, which is Librium, and clonazepam, which is Klonopin. An example of a hypnotic is Zolpidem, which is Ambien. Although these are prescription medications, they are commonly misused. Chronic use of benzodiazepine causes changes in the GABA receptor, resulting in decreased GABA activity and the development of tolerance. When benzodiazepines are no longer present or suddenly present at lower doses, withdrawal does occur. Sedative, hypnotic, and anxiolytic intoxication can cause behavioral psychological changes such as slurred speech, incoordination, unsteady gait, nystagmus, impaired attention or memory, and stupor or coma. Benzos are not detected by standard urine tests for drugs of abuse. However, specific benzodiazepine urine tests identify the metabolites of some benzodiazepines. In benzo overdoses, CNS depression causes the occurrence, and that is what's commonly involved in a drug overdose. They're often co-ingested with other drugs such as alcohol or opioids that cause stupor, coma, and respiratory depression. When treating benzodiazepine overdose, end-tidal CO2 is used to monitor clients at risk for hypoventilation, and sometimes endotracheal intubation and mechanical ventilations are required. The chronic use of benzodiazepine does lead to life-threatening withdrawal. Signs and symptoms of benzodiazepine withdrawal include tremors, anxiety, general malaise, perceptual disturbances, psychosis, seizures, and autonomic instability. Withdrawal is treated with long-acting benzodiazepines, such as diazepam, and titrated to prevent withdrawal symptoms without causing excessive sedation. That dose is then gradually tapered. What is the main difference between stopping the use of cannabis versus opioids or benzodiazepines? In 2020, about 2.6% of people in America aged 12 and older used hallucinogens. Hallucinogens are a diverse group of drugs that alter a person's awareness of their surroundings as well as their own thoughts and feelings. They're commonly split into two categories: classic hallucinogens like LSD and peyote, and dissociative drugs such as phencyclidine and ketamine. Hallucinogens can cause hallucinations, and the dissociative drugs can cause users to feel out of control or disconnected from their bodies and environments. Historically, some cultures have used hallucinogens like peyote as part of religious healing rituals. Users of hallucinogens and dissociative drugs have an increased risk for serious harm because of their altered perceptions and moods. As a result, they might do things they would never do when not under the influence of hallucinogens, like jump off a roof or act on suicidal thoughts. PCP is an example of a particularly dangerous hallucinogen. It's a legal street drug that usually comes out as white powder that can be inhaled through the nose or injected into the veins. It can also be smoked or swallowed. Within 1 hour of ingestion, some of these signs and symptoms can occur, and it's usually 2 or more. Vertical or horizontal nystagmus, hypertension, tachycardia, numbness or diminished response to pain, ataxia, slurred speech, muscle rigidity, seizures or coma, and hyperacusis, which is a sensitivity to noise. Sometimes physical restraints are necessary to control clients that are experiencing psychomotor agitation, followed by chemical sedation with intravenous benzodiazepines. Overdose can occur with some dissociative drugs like PCP. In high doses, PCP can cause seizures, coma, and death, especially if taken with depressants such as alcohol or benzodiazepines. Dextromethorphan is an over-the-counter medication that is misused due to its hallucinogenic effect and can cause overdose. Signs of toxic doses are neurobehavioral changes such as hallucinations, inappropriate laughing, and psychosis, tachycardia, dilated pupils, diaphoresis, and a zombie-like ataxic gait. Because this is commonly found in cough and cold medications that also include acetaminophen, toxic doses can cause a severe delayed effect of hepatotoxicity, hepatic failure, and death. Stimulants include amphetamine-type substances, cocaine, and crack. They can cause release of dopamine in the brain and are highly addictive because of the flood of dopamine in the brain's reward circuit strongly reinforces the brain and these drug-taking behaviors. Approximately 2 million Americans used methamphetamine in the past year. The National Institute on Drug Abuse data shows that overdose death rates involving methamphetamine quadrupled from 2011 to 2017. Methamphetamine comes in many forms and can be ingested by smoking, swallowing, snorting, or injecting a powder that's been dissolved in water or alcohol. Long-term use of methamphetamine has many negative consequences, including extreme weight loss, severe dental problems, intense itching leading to skin sores, involuntary movements, such as dyskinesia, anxiety, memory loss, and violent behavior. Cocaine is another powerfully addictive stimulant drug made from the leaves of the coca plant, native to South America. It's estimated that 5.5 million people aged 12 and older have used cocaine, and cocaine can also be processed to make a rock crystal called crack. This produces vapors that are inhaled into the lungs. In the short term, can result in increased blood pressure, restlessness, and irritability. In long term, severe medical complications of cocaine and crack include heart attack and seizures. Some signs and symptoms of stimulant intoxication are tachycardia, hypertension, pupillary dilation, elevated or decreased blood pressure, perspiration or chills, nausea and vomiting, weight loss, psychomotor agitation or retardation, muscle weakness, respiratory depression, chest pain or cardiac dysrhythmia, confusion, seizures or coma, psychosis and hallucinations, dyskinesia or dystonia. It's important for nurses to be aware that individuals with acute methamphetamine intoxication may, without provocation, develop severe agitation and can become violent. There's the hyperthermia and the control of the agitation are the top priority. Some interventions for that are intravenous benzodiazepines. However, physical restraint should be avoided because clients who physically struggle against restraints undergo isometric muscle constrictions and contractions that are associated with lactic acidosis, hyperthermia, sudden cardiac collapse, and death. Airway management with endotracheal intubation and mechanical ventilation may be required. Aggressive cooling is achieved through sedation, fluid resuscitation, external cooling blankets, or evaporative cooling techniques. For inhalants, about 0.9% of people 12 and older in America have used them. Unlike illicit drugs, the percentage of inhalant use was highest among adolescents ages 12 to 17. Inhalants are various products easily bought or found at home, such as spray paints, markers, glue, gasoline, and cleaning fluids. Inhalant intoxication causes problematic behavior or psychological changes like belligerence, assertiveness, apathy, and impaired judgment. Some other symptoms are dizziness, nystagmus, incoordination, slurred speech, unsteady gait, lethargy, depressed reflexes, psychomotor retardation, tremor, and generalized muscle weakness. They can also have blurred or double vision, stupor, coma, and euphoria. Long-term effects of inhalants may include liver and kidney damage, hearing loss, bone marrow damage, loss of coordination and limb spasms, and delayed behavioral development. Acute intoxication with inhalants can cause life-threatening seizures and coma. Many solvents and aerosol sprays are highly concentrated with many other active ingredients, and sniffing these products can cause the heart to stop within minutes. This condition, known as sudden sniffing death, can happen to otherwise healthy young people the first time they use an inhalant. Treatment consists of maintaining cardiorespiratory function with 100% oxygen administration by rebreather mask and implementation of the pediatric advanced life support protocols. They may require endotracheal intubation and mechanical ventilation as well. What is one physiological response that hallucinogens and stimulants have in common? Amazing work, everyone, and keep going strong.